Group counselors should consider when it might be appropriate to expose their beliefs, decisions, life experiences, and values. When is it appropriate to do self-disclosure? We need to let the members of the group find answers that are congruent with their own values and be very careful that our self-disclosure isn't imposing our values onto them. There are some group leader behaviors that are hallmarks of ethical, professional, and effective practice. Let's look at a few of them. An effective group leader demonstrates acceptance of the client, non-judgmentalism, avoids responding to sarcastic remarks with sarcasm themselves. Effective group leaders are honest with the group and very genuine. They avoid judgmentalism and labeling of the members. They state observations in a tentative way rather than dogmatically. A good group leader lets members who are difficult know how they are affecting the group dynamics and affecting others in the group, and they do this in a very non-blaming way. A good effective group leader can detect their own countertransference and will take steps to deal with it. They avoid misusing their power. These group members provide both supportive and caring confrontation. They're very careful to avoid meeting their own needs at the expense of the members. A good group leader would be able to know how to handle diversity in group work. Group counselors that are well versed in diversity can acknowledge that ethnicity and culture do influence behavior. They consider the impact of adverse social, environmental, and political factors in assessing problems and designing interventions. They acquire the knowledge and skills to work with the diverse range of members in their group and come to understand them very clearly. They are aware of their own cultural background, attitudes, values, beliefs, and biases. And they develop sensitivity to issues of oppression, sexism, and racism. They respect the roles of family and community hierarchies within the culture. These group leaders respect members' religious and spiritual beliefs. They assist members in determining those instances when their difficulties stem from other racism or biases, so they don't personalize their problems. They inform members about basic values that are implicit in the group process, and they can do this with a little bit of self-disclosure. It's very important that every group leader become familiar with the uses and abuses of group techniques. Let's look at some of the techniques that can be abused in unethical ways. These would be using techniques that clients are unfamiliar or even uncomfortable with. Using techniques to serve their own hidden agendas or enhance their power. Using techniques that create an intense atmosphere because of the needs of the counselor. Or using techniques that pressure members, maybe to do things that they're uncomfortable with or don't want to participate in. Here are some guidelines for avoiding these abusive techniques. Only use techniques that have a therapeutic purpose and can be grounded in therapeutic theory. The client's self-exploration and self-understanding should be fostered in these techniques. The technique should be unique to clients and assist clients in exploring new behaviors. They should modify techniques to make them suitable for culture and not make the clients uncomfortable. We want to use techniques that enhance the group therapy, not to cover up the counselor's incompetence. These techniques should be used in a timely and sensitive manner. If they're not working, don't force them on the clients. Try something different. The tone of the leader should be invitational, but keep in mind that the clients can participate or skip an experiment. It's their choice. Counselors should only use interventions that they have been trained in. Techniques can sometimes bring an emotional release, so be ready for that. And always ask the question, whose needs are being met by using these particular techniques? Now be very careful because, as previously mentioned, the techniques can maybe bring up some unfinished business. Be careful that you're not leaving the client opened up or raw at the end of the session. Give yourself enough time that you can do a really good therapeutic closure. So when they leave group, they're not feeling very vulnerable. For example, if you've got a substance abuse group, talking about drugs and leaving a client craving before they leave group can be very dangerous, so be careful that they're very grounded. Every group counselor should seek consultation and have a good referral source, because it's important that you make referrals as needed. Don't be afraid to seek the help of other professionals, like traditional healers or religious or spiritual leaders. Also, seek out any educational experiences that can help foster knowledge and understanding of the skills you're trying to develop. And again, always seek consultation and supervision. To close out the chapter, let's talk about issues concerning termination. Keep in mind that the ending of a group sometimes triggers other losses that members have experienced. There may be a grieving process. This particularly happens with residential and outpatient treatment. Sometimes these groups have been together for a really long time. It's important to identify and explore these feelings as a group. Members need to learn how to say goodbye. Sometimes this can be a painful issue for them, but they need to be taught that there are healthy ways of letting go. And again, make sure that you as the counselor are not uncomfortable with the termination process.